Ladies and gentlemen, we now have our penultimate panel discussion of day one at Arab Health. I'm sure you'll all join me in agreeing that the M42 team, with all their wonderful partners, have organized an amazing program so far. And this is just day one. We have 4 days in total. We've had some presentations, some firesides, and some deep diving into panel discussions. The next one, I get to moderate as well as be your MC over these 4 days, and I'm super excited because the title, frankly, it gave me a bit of a laugh. Improving well-being, yes, a very serious subject matter, and reducing pajama time by tech. Now, I'm intrigued about that title, so I'm hoping you'll all be intrigued as well. Now, I've been speaking a lot on stage this week. I want this session to be as interactive as possible. I will be opening it up to the audience, so please have your thinking caps on. For now, have your clapping hands ready. Please join me in welcoming on stage Dr. Sama Noor, the Chair of Occupational Medicine, Cleveland Clinic, Abu Dhabi. Dr. Amina Al-Mashoudi, the Manager of Occupational Medicine Services at ADNOC, and Dr. Andrew Jerry Jenko, who is the Medical Director of Occupational Medicine, Capital Health Screening Center. Thank you so much. And I shall take my seat over here on the right-hand side. Now, I began, ladies and gentlemen, by introducing with my audience that I had a bit of a tickle looking at this title. Now, I know pajama time has an official meaning behind it as well. What does this title mean to you all? Dr. Andrew, I'll begin with you right at the end. Please hold the mics as close as possible. Well, while we fix your mic, we can... Dr. Amina, let's go with you. You have the mic and I think it's working. So I'm going to go to Dr. Amina as we... What does this title mean for you? When we talk about well-being and reducing pajama time, what's your understanding of it?
It reminded me with the COVID pandemic time where we've been working longer hours. So the indication of pajama is like working extensively day and night, especially the healthcare professionals. So this is the meaning of the title to me.
I see. And Dr. Andrew, is your mic working now?
It is, yes, thank you very much.
The layman's interpretation of pajama time might be something which is actually quite comforting. But no, you're saying there's a lot of admin involved and a lot of work involved there.
Yes, look, I was actually working until about 2 o'clock in the morning last night, writing reports, and I was doing it in my pajamas. So it's something that a lot of doctors do. We take a lot of work home, a lot of nurses do as well. We actually keep working at home, we're on emails, we're getting texts, we're getting WhatsApp, we're getting lots and lots of demands on us at all times, and that is reducing our pajama time. Of course, it can mean sleep as well, and sleep is very important too.
So it has a double meaning there. Dr. Sama, taking on that double meaning, when we talk about using tech to reduce pajama time, what do we mean by that?
So the MA calculates that for every hour that a physician does seeing patient care, they spend 2 hours on the back end. So for physicians that went into this role to spend time with their patients, to diagnose them, to spend 2 hours every day for every hour they spent with a patient is kind of a loss of training, a loss of resources. So when we think about the electronic medical record, as it came in, I think a lot of us were very excited at how it's going to revolutionize medicine. Here's a tool that can make our life easier. But over time, there's been an evolution in the medical record and how we do our charting. And it became a very process-oriented and not a people-oriented. And I think for a lot of us that went into medicine, it's all about the people and about the diagnosis and the relationship that we have.
Fantastic. And at that point, I'm going to bring in Dr. Amina again. So that was a really good way for us to set the scene, not only about what we're going to be addressing in this session, but also some of the issues that we're talking about, the admin, the extra work, and that takes doctors away, the frontline staff away from patients. Dr. Amina, when it comes to ADNOC, what are some of the initiatives which are tech-related that you're introducing or have introduced and seen some great success when it comes to improving well-being of medical staff and your staff. Please keep the mic really close, yes. Oh, oh, it's still not working.
I wanted to highlight that our people health and well-being is one of the strategic priorities in ADNOC. It's an integral part of our culture. And as you said, the technology is evolving, and in order to support our people, we need to ensure that we have healthy and well people and workforce, and those are our enablers towards any sustainable business. So in 2020, we initiated and introduced the Employee Assistance Program. This employee assistance program supported our people. It's not only for counseling or medical consultation. It did include some legal counseling, financial counseling, life skills, coaching, whether it is at work or due to some social problems. Recently, we've upgraded and we enhanced this employee assistance program. Initially, the scope was around 45 people, 45,000 people who are our people, our direct hire. But recently, we enhanced the coverage to cover our contractors and the families of our direct hire employees. In addition, it does not only covers the counseling and the teleconsultations. It included, in addition, leadership training. We are looking to have human-centered leaders who will understand the needs of our people, of our population. So this is very important. Upskilling our leaders in well-being principles, including the mental well-being principle, in addition to many programs, physical and face-to-face programs targeting our employees and their families.
Fantastic. So that sounds suitably comprehensive. And as you there, not only are you improving the well-being of your staff, you're also impacting families, their dependents as well. So it sounds like it's a very comprehensive program. My mic is dropping out a little bit, so I think I might need a better mic. But I'm going to hand over to Dr. Sama now, and let's talk about the intersectionality of well-being and sustainability. What are your thoughts on that?
So we were actually discussing how our human resources department in all three companies
Please hold the mic right there.
is actually called human capital. And I think there's no greater gift in any organization. And I know we are a very high-tech company, but I think there's no greater gift than the humans that we have within our organization. And when you think about healthcare, the one struggle that we have, I think, in maintaining a sustainable workforce is burnout and people leaving the industry more than any other industry. So the Surgeon General of the US came out recently and called burnout as a pandemic. This is at the same level as smoking. And so 40% of nurses are expected to leave healthcare within the next 3 years. 1 in 4 doctors are going to leave healthcare within 3 years. And that's because of...
Dr. Sama, that's a really shocking figure. And I'm just going to ask you to keep the mic really close to your lips so that we can make sure everybody hears what you're saying. Just to interject there, really, really shocking figures. And when it comes to your particular insight in terms of what you're achieving, please give us an insight in terms of that.
So we are using organizational approaches and personal approaches to well-being. And I'm actually proud to say that in terms of our outcomes, our retention is actually higher than our sister companies in the US. And I think that's because we look holistically at well-being. Well-being is not just about yoga programs. No insult to people who love yoga, but it's about looking at organizational and systemic factors that keep us in these organizations. And just in terms of sustainability, so for every physician you lose, you have to pay $500,000 equivalent to recruit. And we thought these numbers are really high, but when we validated it internally, it was the exact number. So better than, what better way than keeping the organizational sustainable than investing in your workforce.
And I think that's a really broader term of sustainability that we can embrace in this discussion. Often sustainability, due to the big focus on the environment, is merely thought of in an environmental sense. But we're talking about sustainability of workforce, as you mentioned there. And Dr. Sama, you outlined this very shocking statistics, but also that positive story that your retention rate is much higher than the average. So that's a really key point to emphasize there. Dr. Andrew, patiently waiting there at the end, as the ladies have been taking over the stage today. Dr. Andrew, would you like to build on that and talk about some of the insights that you have when it comes to medical specialists and that intersectionality of sustainability and wellness?
Yeah, sure. First, taking care of your workers saves money. I worked for a hospital in Australia. By having a good program, I called it the culture of caring. We actually saved about $3 million a year just in healthcare costs for our employees, ended up saving $30 million over 10 years. Not only that, by helping doctors, giving them artificial intelligence tools. Last night when I was doing those reports, I was using a large language model. It made it so much faster. So that way I could get to bed at least by 2. So, it is making a difference. In capital health screening, our radiologists are now doing 1,000 x-rays a day with the assistance of artificial intelligence. So we can actually screen more people with the use of artificial intelligence, and they're supported. They feel like they've got a backup. And lastly, as an example, tuberculosis, we screen workers who come here for tuberculosis. We've got a lot of nurses from India and Bangladesh, and Philippines, and we've got workers from all over the world, and they do bring in risks, typhoid, tuberculosis. What we've seen through screening is that Qatar actually let them go, had a good rate, and then they let them have screening at home. We kept screening here in Abu Dhabi, and we have now a 40 times lower rate of tuberculosis than the country with similar income, similar oil and gas, 40 times higher rates of tuberculosis. And with drug-resistant tuberculosis, prevention works. Prevention is better than cure. I actually believe artificial intelligence will actually make us better at screening, make us better at doing wellness, and we will have targeted wellness that will actually do the right programs for the right people.
And I think that's a very optimistic way of looking at technology. Before we delve into that, I'm just going to open it up to our wonderful audience, which have been with us, and I can see very enthusiastic faces. Do people have questions? Oh, brilliant. We've got a question right here at the front. Anybody else? Please do indicate, because I'll come to you next. Please introduce yourself and who your question is for, or everybody. Is your mic working? If not, you can take mine.
Hello.
Oh, perfect.
Yeah. Hi, my name is Gus. And my question is for Dr. Noor.
Sorry, your mic is breaking up, so take mine. Only for a moment.
Okay, let's try. Hi, my question is for Dr. Noor. Dr. Noor, what exactly are you guys doing different in Abu Dhabi that in the US we can learn from in terms of retention?
So our department is actually called Caregiver Wellbeing because we don't believe in occupational health being individual. Very similar to ADNOC, we offer employee assistance program, but we look at well-being in many domains. So we look at physical, mental, emotional, social. So actually our goal for this year was about social connectivity. And one of the things was having engagement programs within the departments. For mental health, we have a portfolio very similar to CCF. I think what's unique about our organization is that we have people from 90 languages, and we all have pride in what we do. We are very connected to the mission. What I can say about Abu Dhabi versus the US is everybody knows everyone, and I think that community feeling just makes people want to be part of the mission. And in terms of the organization itself, it's a very small organization and very informal in a lot of ways. So I think it makes us a little bit luckier than you guys. We're not dealing with the same payer systems, the challenges with billing. We do have other challenges in terms of, the workforce and that it's a nomadic population. So 80% of us are nomads or expats rather. But I think I think the strength is connection to the mission, pride in what we do, and leadership that's invested in well-being.
I think that's a really insightful answer. And the question also, the idea of learning from some of the test cases and the positive results that the UAE is able to champion. Thank you so much for going through all of that. May I ask if there's any more questions from the audience? If not, I have more questions to ask. Well, maybe we'll come back to you. I like your enthusiasm. Dr. Amina, if I can bring you in on that question there. What more can the world learn from the UAE? There's so much that's being achieved here. I feel like someone who was a BBC journalist, moved here 10 years ago, and really now is dedicated to this role, emceeing and moderating and celebrating what the UAE is achieving. What more can we tell the world about what's happening here?
We believe in our people, and this comes from our leadership. And as mentioned by Dr. Samah, that we really value the connectedness of the people with their society, with their families. Sheikh Mohammed bin Rashid said that this year is the family year. So how we gonna translate this in our strategies and in corporate? How we can reflect this in our policies and procedure? It's not only the well-being program, but we need to have well-written policies and procedures that support the well-being strategy. This is very important.
And I think that's really strong, hearing it from yourself, Dr. Amina. With ADNOC, you have over 45,000 employees, you were telling me, so your reach is huge. And that idea of family, I have to say, having lived here for a decade, and I know my panelists, we are just really, we're glad to be able to collaborate with the Emirati community. The family word is actually everybody who resides in the UAE, who contributes to the UAE. Dr. Andrew, if I can bring you in there, I know you were speaking quite powerfully about this off stage as well, that kind of community care and collaborative effort.
Yeah, look, I think it's really important. Vaccination. I like vaccination because I know it works. Summer has got a 90% flu vaccination rate because she's 97%.
97.
Sorry. Because she has good policies and she has support. So that actually prevents not only you getting infected from your patient, but you infecting your family and making them sick. And then when your kids are sick, you can't go to work. So this idea of protecting health is really important. Technology. I came here, one of the reasons that attracted me is M42 has got such a great technology arm. We have got the best AI in the world, and we've got hospitals where we can actually apply that technology. So I'm excited that we can actually make a big difference for our health workers and for their families. And it will be targeted wellness. People talk about wellness and they say, oh, get us a nutritionist. That's very old school. You're like 10 years behind the time if you're asking for a dietitian to come and talk to your workforce. There's so much more you can do now with wellness. There's anti-aging, longevity medicine. There's brand new medication. There's obviously, all the movie stars are taking Ozempic. So you've got a lot of different tools out there, and wellness is much more than exercise and eat well. That's the old way of thinking. That's not the new way, and we can actually introduce you to the new way.
Fantastic. There's so many threads you've introduced there. I want to pull on all the threads, but again, to just open it up to the audience, was there another question that we have through? Oh, yes, fantastic.
Hi, thank you. My name is Larisa Tkachenko, Medscan Group, Russia. The occupational medicine is of high interest in Russia because we are the manufacturing country. And the main challenge currently for all the well-being programs is the access to data, the integration of medical data and human resource management system. And this is the main challenge for the human resource directors. How do you see the strategy and trends in this data management in occupational health?
Who would like to take on that fascinating question? Thank you very much.
So because we are striving to be a sustainable organization, one of the things we first did was collect biometric data in all our caregivers. Our employees are called caregivers. And because I knew at the end of my 1 year, I was going to ask, hey, how much did you save, right? So one of the things I wanted to do was not only show the health value of what we brought into the organization, but look at the financial data. And part of any corporate wellness program is looking at the biological data. So we have the BMI, we have the blood pressure, we have the medication, we have their profile in terms of how they're doing. But with that, interestingly, people, for example, who have diabetes that is poorly control tend to be out of work a little bit more. So with that, you can link it to absenteeism. And with that, there's a cost associated. So having interventions targeted towards this small group that may have poorly controlled disease may allow you to show your value very early on. So I think data is very powerful. Understanding that, what you are is not just about vaccination, not that I don't think vaccinations are great, but I think it's hard to prove to someone the value of not having a disease, but showing them the productivity metrics, the absenteeism, that financial data.
Fantastic. Thank you for that question and for that comprehensive answer. I've got more questions, but I won't be too selfish. Can I share the time of our panelists with anybody else? Any more questions? Enthusiastic gentlemen, we always like that, so let me give the mic to him again.
Hi, yeah. Dr. Andrew, you mentioned about that the well-being is very important. So you mentioned it's like 5 different things that you talked about. How are you actually applying it, or how can it be really practically applied in this new age that we're in?
Look, I find it easier just to talk about cases. So last night I had a case. She has a back injury, a young lady, and she hasn't been to work for 183 days. She's been getting sick leave after sick leave. She's had MRIs, she's had ultrasounds, she's had CT scans. She's seen about 10 specialists. She keeps going back and asking for more sick leave, and no one is trying to get her back to work. She's actually just getting the sick leave all the time. And when I tried to tell her, no, you have to go back to work, this is important. Work actually gives you money, helps you pay for school fees for your kids. It's actually really important. It was almost like this was a new concept to her. So that's one example. Absenteeism management, we have a lot of people who are taking a lot of time off, and we can actually manage them. And what all the statistics show is that if you get those people back to work, they actually become healthier. You get distracted from your pain, you actually forget your pain, and you actually heal yourself. But if you just let them sit at home and go, oh, I hate my boss, I hate everything, my back's sore, they get worse and worse and worse. So that's just one practical example. But there's multiple examples that we can talk about. COVID was really managed very well in this country, and in Qatar we had very low death rates compared to the US. The US had over 1 million people die. The death rates were astoundingly much higher than here because people got vaccinated. People actually followed the rules. They had a systematic approach. So occupational health protects workers, but it also protects the community. And I think that's a very important thing to understand.
And I think that's thank you very much for that second question. And that really brings us back on to looking at how the pandemic was a test case for introducing technology in a rapid pace out of necessity, but also a welcome way for us to experiment and measure changes. Dr. Amina, you were sharing some stories with me off stage about ADNOC's Employees Assistance Program and just how that was accelerated during the pandemic. Please give us an insight in terms of how tech enabled that health innovation for you.
So, as you know that,
Mike, all the way.
yeah, ADNOC is a global energy company, and we do have a lot of operations, different operations. When the COVID pandemic evolved, we invested a lot in implementing the high tech and the integration between the human capital system with the medical system, with the government system, in order to ensure that we have the healthy manpower who will be able to meet the business needs. However, the well-being of our people also was evolving, and we were pioneer in implementing the employee assistance program through the ICAS company, and the 24-hour availability of this program, whether it is consultations or counseling or even a referral to the medical providers if this is really required, has contributed a lot, has contributed to the continuity of our sustainable business during the COVID pandemic, contributed also to our economic stability. In addition, we were able, through the use of the resources that we have, whether it is the technology, the system integrations with other systems, and the mobile units, and covering our vast areas of operations from onshore to offshore.
I think you made some really strong points there, Dr. Amina. Thank you. And especially you echo the fellow panelists in saying that this is really a business case for wellness and technology, not just a nice to have. And on that note, I'm just going to end by asking all our panelists to maybe share a vision of what you would like to see in the future, maybe an idea or what could be introduced to improve that intersection of wellness and technology. Dr. Andrew, if I can start with you.
Well, just with the pandemic, I went from paper writing, I was swabbing about 100 people a day to swabbing 1,000 people a day with an iPad and scanning IDs. So, that just shows you how effective technology can be at rapidly dealing with a pandemic situation. But what that tells me, so your question was about my vision for the future.
Yes.
My vision is that we're actually going to, work is going to make us healthier. We're going to come to work and we will have systems that support us, and we will be very proud of the work we do. We're going to take home a lot of pay, and we're actually going to be encouraged to exercise. We're going to be encouraged to take some of the, if you're diabetic, you'll be started on your diabetic treatment earlier. You won't wait for your kidney failure before you actually start dealing with it. I can see a vision of work actually being a place of health. And that's what we really want to do, is we want to change it from a place where we get run down and burnt out to a place where you actually come and you do good things and you actually create health, not only for yourself, but for other people as well.
Dr. Summer, your vision?
So to me, well-being is about being happy, healthy, and prosperous. Happy is about emotional and mental well-being. Healthy is mental and physical well-being. And prosperous is exactly what you said, occupational well-being. So I think if you have that along with community, what more could you ask for?
And that brings us nicely on to Dr. Amina, the sense of community. You mentioned this is the year of the family. What's your vision?
What I can see that in the future, maybe the well-being of the manpower and the personal well-being might be one of the KPIs on a person. You need to have your well-being index as part of the elements that measure your performance during your annual performance review. So this is very important.
Well, ladies and gentlemen, my well-being has certainly improved during this panel discussion. I hope it has improved for you as well. Please do give my panelists a big round of applause. Thank you so much. And while we're still here, we're going to get a photograph of us seated and then of us standing as well. Thank you.